Thank you very much, Sylvia, for that kind introduction, and good morning, everyone. Before Sylvia started, I listened, it sounded like a really good cocktail party. And I was thinking, but knowing this group, I know most of you, I think it will continue in that vein throughout the entire morning and afternoon and again tomorrow. So I'm looking forward to that. I'm very interested in the banana logo because it brings up a whole other issue of banana diseases, and GMO might be the only way to fix that. And so that gets into social issues as well as technology, which I'd very much like to discuss at the end of our session. We will not have questions after each speaker, but we'll have a vigorous discussion at the end of it, and I think that will be wonderful. We have just outstanding speakers at this forum this morning and tomorrow, and I'd like to introduce our first speaker, Dr. Adam Drewnowski, a very good friend of mine. Adam is professor of epidemiology and director of the Nutritional Sciences program at the University of Washington School of Public Health. Adam was a member of the planning committee for this workshop and brings a wealth of knowledge in healthy eating, obesity, and social disparities in diet and health. He will set the stage for the workshop with a discussion on the dimensions of sustainability. Welcome, Adam.
Good morning, everyone. In my presentation today, I want to discuss the multiple and interdisciplinary dimensions of sustainability and also to set the stage for what is to follow. And see here. Okay, we have excellent. So I want to draw your attention to two documents. The first one is the Giessen Declaration from 2005 that very few people have had. It has not really been as publicized as I would have hoped. This was the first statement that said that it is time to reformulate nutrition science to include social and environmental as well as biological dimensions. And nutrition ought to include the study of food systems and the environment, and the expanded nutrition science ought to be the basis for public policies. So this is the first mention I've ever seen of personal, population, and planetary health, and it dates back to 2005. It was signed by a number of prominent nutrition experts, and the idea was to embrace the other sciences and clear the way for a more interdisciplinary approach to nutrition. The other document is this one. This is the basic definition of sustainable diets from the Food and Agriculture Organization of the United Nations from 2010. This statement reads like it was written by a committee, and perhaps it was, but it does bring up a number of interesting dimensions. So sustainable diets are supposed to be protective and respectful of biodiversity and ecosystems, culturally acceptable, accessible, economically fair, affordable, nutritionally adequate, safe and healthy, while optimizing human and natural resources. I boiled it down to four principal dimensions. The four principal dimensions are these. Nutrition and health, number one. Economics, number two. Society and culture, number three. And the environment, number four. So make no mistake here, sustainable diets, according to FAO definition, are not only those with low environmental impact, but also the ones which are healthy and affordable and acceptable to society. And very often I hear people talk about sustainable diets when they really mean the impact on the environment. And sometimes this is the only measure they use. Is it good for you, and is it good for the environment? Well, there are actually four dimensions. Economics and society are the ones which very often are missing. We should be including all four. So diets aren't healthy and sustainable. They are sustainable only if they are healthy to begin with. And I'll refer to that argument later on. So remember, there are four dimensions: nutritionally adequate, affordable, culturally acceptable, as well as planet-friendly. All of those four go into our consideration of sustainability. That means there are going to be inherent contradictions in a system, and some trade-offs and compromises will need to be made. First of all, the basic issue is that some of the energy-dense foods are actually nutrient-poor. Some of the energy-dense foods have a low impact on the environment, but they are not nutritious or not sufficiently nutritious. But they are cheaper. Nutrient-rich foods are often more expensive and more costly to the environment, but they provide us with necessary nutrients. So as a result, you see a number of compromises have to be done, and that means we need to get data from multiple sources, do exact modeling, and be able to predict the future diets which optimize all those various considerations, which in some cases are in fact incompatible. In fact, an extreme case that is suggested to me by the work of Nicole Darmon and Jenny McDermott is this. If you want a plant food with lowest land cost, lowest water use, and lowest greenhouse gas emissions, look no further than sugar. Not good news for nutritionists, but I say, well, sugar may meet the criteria of environment and cost, it's low cost, and maybe even society, but what about nutrition? It fails that. So we need to have foods which actually bring in all those four dimensions together, and as I say, nutritious diets, sustainable diets, affordable diets, some compromises will need to be made, and those compromises will not be the same for all countries and all regions and all neighborhoods. It is all, as you will see later on, context specific. So food needs to be nutrient rich, affordable, accessible, appealing, as well as safe, of course, and increasingly with low impact on the environment. So this formulation means that we increasingly focus on the food system and not on individual foods, maybe not even on individual food patterns. We look at the food system all the way from production to processing to consumption to waste and disposal and then to nutrition and health. It is a long continuum and a long chain. The path does not go directly from more food being produced to health. All kinds of connections and considerations go in between. There are a number of visualizations of the system, you'll see them later on, and there is going to be a major need for data inputs and metrics and models from various sources, from agricultural production, from life cycle analysis, from purchases to consumption to health, and all those various data from various sources, private and public, need to be combined into metric development and then into integrated modeling. And luckily for us, we actually do have experts here in the room. What we wanted to do with this workshop is make sure that there were data and people who dealt with data and people who actually dealt with models and were able to formulate and evaluate models. Otherwise, it's just talk. We really do need to have data, and we need to have metrics, and we need to have models. And we'll be hearing about those later on today and tomorrow. One important thing about modeling, I view this as a two-way street. On one hand, the existing diets, which people say are not sustainable, can affect the climate and therefore affect future diets. So to some extent, our diets are paving the way for future diets, like it or not. On the other hand, climate change, global warming can change food production and affect our diets that way. So climate can be the outcome or the cause. Diets can be the cause or the outcome, and we'll be talking more about diets and health and the environment and how they are all going to be linked. Each of those domains has got its own metrics and measures. I will just outline very few of those. So let's start with the domain of nutrition. And here there are two measures that I have been working with. One is energy density, and the other one is nutrient density. It is actually very useful to have an overall metric of food quality and diet quality. The ones I look at are energy density, calories per gram, and nutrient density, nutrients per calorie. Nutrient density has actually been the subject of nutrient profiling, and all you have been reading about nutrient profiles and front-of-pack labels is really based on assessing nutrient density of foods in a convenient way, so you come up with a unitary metric. Essentially, nutrient density is the ratio of nutrients to calories, and then each food is given a score of nutritional value. And when it comes to metric development, this is very useful because then you can start looking at nutrients per unit cost, which foods, for example, give you calcium at the lowest cost or potassium at the lowest cost, or which type of protein is linked to the lowest carbon cost. Having a metric of nutrient density is extremely useful when you start talking about the cost of the nutrients or the cost of calories to society or the environment. I will not go into details of nutrient density modeling. A lot of the work has been published, and for the most part, we have been using a schema developed by the European Food Safety Authority about selecting nutrients to encourage, nutrients to limit, and the various algorithms. Interestingly enough, there is now a new trend to towards what I call hybrid nutrient profiles, where foods are included into a nutrient profile. Not just nutrients, but also foods recognized as healthy. So nutrient profiles are going towards a hybrid model where some of the foods and some of the dietary ingredients are being included. So there are a number of nutrients out there, and generally they deal with positive nutrients, nutrients to limit, and we play with the gamut of positive nutrients, protein, fiber, vitamins, and minerals, negative nutrients or disqualifying nutrients, saturated fat, added sugar, and sodium, and now we're going to be adding food components and ingredients to the mix. But there is going to be a cost component. So it's not just about nutrients and calories and energy density and nutrient density. There are, in fact, economic consequences. First of all, notice that energy-dense foods, the fats, the sugars, the grains, very often have got lower nutrient density than do vegetables and fruit. When you look at nutrients to calorie ratio, vegetables and fruit have fewer calories, higher nutrient to energy ratio, and of course, the nutrient-rich foods are going to have a higher cost. I love this slide from my friend and colleague Barbara Rolls, who's showing two types of meals, high energy density and low energy density. The high energy density promotes overeating, and in her viewpoint, leads to overeating, overweight, and passive overconsumption. And in fact, foods on the left have become dominant in the food supply. I should say they're all plant foods. We actually overconsume plant foods. We overconsume vegetable oils and sugars and high fructose corn syrup, all of them plant foods. The other plant foods are in the slide on the right. They may be more satiating at fewer calories. They're also considerably more expensive in terms of both time and cost. So this brings us to the cost domain, because now we can attach monetary costs and carbon costs to food, and the carbon cost can be calculated per calorie or per nutrient. And here what we do is to take dietary intake data, nutrient composition data, monetary cost and carbon cost, and try and figure out the cost associated with different foods and the cost associated with different nutrients. There's some interesting things here. First of all, nutrient-dense foods cost more. What you see here on the vertical axis is the nutrient density score I showed briefly, and the energy cost in terms of dollars per 1,000 calories on the horizontal axis. And notice that all the grains and the sugars and the sugary beverages are way on the left, and the vegetables, the fruit, and the seafood and the recommended foods are on the right, and generally they do cost more in terms of dollars per 1,000 calories. Again, the same hierarchy of food prices applies in other countries. We've done very similar studies in France and in Mexico, and I would love to do more work on food costs in low and middle income countries. I suspect it's going to be exactly the same. Nutrient-rich foods are going to be more expensive. And now we come to the carbon cost of foods. And there is an interesting point to be made here as well. First of all, the carbon cost is often calculated per 100 grams of food or per kilogram of food, and there is little attention paid to what the food actually is. I prefer to look at costs from the standpoint of calories. You need 2,000 calories per day, or from the cost of essential nutrients. You need so many grams of protein per day. What is going to be the cost? So as a result, 100 grams of food or a kilogram of food is completely immaterial, given that some foods have got mostly water. People don't like when I say this, but there's actually more water in spinach than there is in a carbonated soft drink. Spinach is nothing but water. So when you start looking at the greenhouse gas emissions per 100 grams, it is a completely meaningless characterization. And here, when you start looking at 100 grams greenhouse gas emissions, notice, of course, that the meat products and the dairy products are much above the plant-based foods. Things change when you start looking at 100 calories. These are data from the French supermarket Casino. We're looking here at processed fruits and vegetables, meat and meat products per 100 grams on the top axis, on the top panel, and then the same things on the bottom panel rephrased per 100 calories. So when you start looking at greenhouse gas emissions, carbon dioxide per 100 calories, and the energy density of foods, look at the foods at the left panel. The foods with lower greenhouse gas emissions per 100 calories, admittedly they are fairly energy dense, are going to be candy and sugar and cakes and biscuits and potatoes, and then to the right, oils. When you start redoing this per 100 calories and per nutrient density score, notice that there is going to be a direct linear relationship between nutrient density of foods and their carbon cost. So this is where compromises need to be made. Nutrient-rich foods actually are more costly from the standpoint of energy than are candy and sugar. So this is another paradox or a difficulty that needs to be resolved. Of course, a basic calculation, we'll be hearing more about that later on, is that the more calories people eat, the more energy, carbon energy, the diets consume. So let me start finishing here by referring to the fourth dimension, the food patterns. And here, food patterns are determined by society more so than the consumption of individual nutrients. Nutrients can come from a number of sources. Foods are food. So studies in nutrition epidemiology, observational studies, have linked individual foods or dietary ingredients or individual nutrients with health outcomes. One nutrient, one health outcome, adjusting or accounting for everything in between, including socioeconomic status, past history, culture, society, and so on. So I have two problems with that, and again, we'll be discussing those issues. Food patterns really cannot be reduced to individual nutrients. Then, as any sociologist will say, it is hard to separate a person from their food pattern, and it is actually impossible to separate the person from society. For example, it is all about context. We have been doing studies mapping consumption patterns by neighborhood. This is a map of Seattle. On the left, you see the consumption of soda mapped by neighborhood. Of course, you will appreciate that the waterfront mansions cost in the millions of dollars, whereas people who live by the freeway live in cheaper houses and consume more soda. the salad consumption is mostly restricted to the waterfront. The healthy eating index is higher on the waterfront. So it is not simply a question of getting people to switch from one food to another and having everyone eat more salad. These are different people with different resources, with different education, and living in different neighborhoods. And in fact, we can now map obesity in Seattle by census block, and of course, it is exactly as you might expect. More obesity near the freeway, less obesity on the waterfront. It is all about geography, education, income, and yes, food patterns. Which means, and I want to end here on a provocative note, that many of the studies that we have been reading about what exactly causes obesity may be replaced by a focus on food patterns. Notice that the people who wrote that dietary fat causes obesity, exclamation point, and those who wrote that high fructose corn syrup causes obesity were not only the same people, but published in the same exact journals 2 years apart. So I think that we need a paradigm shift. We need to use multiple times of input data. We need to assess the costs and benefits of alternative diets. We need to estimate likely regional compromises and trade-offs, develop models, be sensitive to prices and social concerns, and of course engage academia, governments, NGOs, and the food industry in this collective endeavor. Thank you.